Can. Well, time now for caring for our kids, and we're talking about a real pain in the gut. It can come on suddenly and will require surgery to recover. Of course, we're talking about appendicitis. It is one of the most common reasons for emergency abdominal surgery in kids, most often affecting those between the ages of 11 and 20. Now, appendicitis is a potentially serious swelling of the appendix with signs that should not be ignored. Joining us now for caring for our kids is ER Director Dr. Ryan Redman. Thank you so much for coming in.
Absolutely.
Let's just first start off with and get right to it. People watching at home immediately want to know, what are the signs and symptoms?
So certainly with appendicitis, you're always worried about any significant abdominal pain, especially when it's persistent. It tends to be not the coming and going, but the stuff that stays around. Also can be associated with nausea and vomiting, and then loss of appetite is usually a cardinal feature of it also.
And some people might say, well, that sounds like it could be a stomach bug, or that sounds like it could be something else. How do you know the difference?
That can be the difficult part of the whole thing, is trying to figure out when you're dealing with something that's a little bit more benign or something like appendicitis that would require surgery. So oftentimes we do need to use the help, in addition to our clinical judgment, of our labs and imaging, which a lot of times we're able to do ultrasounds now and sometimes CT scans.
Explain why being able to use ultrasounds is so beneficial right now.
Well, as physicians and especially as pediatricians, we've always had kind of a love-hate relationship with our CT scanners. We love them because they give us great information, they give us really good pictures, and they help us out a lot with making diagnoses. However, we do know that there's a fair amount of radiation involved, so anything that we can do to eliminate or reduce that is a good thing. We found that ultrasound works fairly well for pediatric appendicitis when it's in the hands of a person who's competent in it. So we've started a program at Children's. We've been able to reduce our CT scanning rate by a significant amount. And then we also have new scanners that have a much lower radiation dose. So between those two, we've been really thrilled with the amount of safer imaging that we've been able to do without losing any diagnostic accuracy.
And I'm sure parents are loving to hear this as well, knowing that they don't have to expose their child to more radiation.
Absolutely.
Let's talk about the urgency. Why is there such an urgency to get appendicitis confirmed and to know what it is?
Well, the big risk with inflammation of the appendix is that if left untreated, it can burst. And if it does, then you're set up for all sorts of potentially serious complications with intra-abdominal infections and things like that. So it is the kind of thing that if you get it caught early, it can usually be taken care of with a laparoscopic approach with a minimal recovery time. And of course, you don't need your appendix, so once it's out, it's not going to affect your life at all.
And you really need to stress that to parents, because you think you're taking an organ out that there's going to be a need for it, but children are just fine after the surgery.
Absolutely. Go their entire life without ever missing it.
All right. Dr. Ryan Redman, thank you so much for coming in. Great advice from Children's Hospital. Thank you so much.
Thank you.
All right, everyone. If you have any question about your child's health, all you have to do is email Lori Tucker at ltucker@wate.com, and be sure to tune in each and every Thursday right here on 6 News at 5:30 to see if we use one of your questions on the air.